Morning, ladies and gentlemen. I would like to call to order this Board of Johnson County Commissioners along with the ARPA Committee special meeting on this Tuesday, May 24th, 2022 at 10 o'clock a.m. We have just a few agenda items, so we'll get right into that. First one on the list is approval of funding for the completion of animal shelter renovation. That is not to exceed 1.2 million. So we want to have some discussion on that. Motion.
Discussion.
You want to talk about the project a little bit, maybe?
Yeah, I never have seen exactly what we were doing there.
There's schematic designs out on it. We're adding on to the west side. We're adding on kennel areas for the bigger dogs, because right now we only have 2 kennels for bigger dogs, and if you put them in those smaller kennels, they seem to go nutsy. That addition, there's an addition of a sink back there. On the north side, there's an addition of a new reception area, and that would be where the people come in to actually pick up dogs. Dogs will be brought in the south side. Dogs will be let out in the north side. And there's exam rooms, working rooms, public meeting rooms for people to meet the dogs or whatever in that area. And basically just an expansion of the cat area, because we're really short on that. And when those cats get that whatever disease they get, they have to be isolated. So we've got a lot of that going on right now. And again, all this is due to increase in influx of animals that are coming in to try to avoid putting animals down for room.
So it's an expansion of the existing facility. It's not a new
expansion. Is this? Yeah, we're the north side will there'll be a connector walkway to that north side, and then none of the existing north side units or any of the landscape or the access to the back will be disturbed. It'll all be left intact to try to keep that monies down on that, but very much needed. We're out of space, and I don't know if you guys have been receiving emails, but I have. We're getting really close to maybe having to start putting animals down to the room, and I'd like to resolve that issue if we can. We've been a no-kill for a long time.
This is pretty much a direct result of the pandemic. People bought dogs and cats and decided when they had to go back to work,
or they just decided they couldn't afford to keep them.
They surrender them.
Yeah.
Okay.
I see we have it categorized right now as to be determined.
Right. Well, and what Kevin Walsh just said, Kevin Walsh, you know that one, is true. I mean, anecdotally, we do believe that there may be an influx due to people adopting animals during the pandemic and then finding out maybe once they had to stop working from home that they couldn't tolerate the animal anymore. But we don't necessarily have any findings of fact or anything like that from the animal shelter yet. So that's something we can work on and see if it's something that could be properly categorized as a regulatory expenditure for a response to COVID-19. It's something we'll talk about with Baker Tilly. Right now, I said assume that it's all in the discretionary bucket for the purposes of today.
Are we still using an offsite private facility for large animals, equine? I know before they had somebody that had an equine facility they were using for.
I'm not sure on that at this point, Ron, but I mean, those wouldn't be considered in this add-on at this point.
Yeah, I realize that, but I didn't know whether that was something we might consider if
No,
there was a need or not.
I don't know that there's a need at this point. I haven't been made aware of a need, and I'm in pretty good contact with him. I know Sheena is too. I haven't heard any express need for horses or large animals at this point, but doesn't mean there won't be.
With this addition, is there any anticipated add to staff or any operational expenditures that would be ongoing?
Not that I would be aware of. I mean, I think we have the staff, we just don't have the room at this point.
I took a tour as you know, of the facility, and there's no doubt that they have the overcrowding, and they've adapted closets to put certain eligible animals and cats, and it's not the way to do business and do it properly. I'm trying to recall, was there a portion of like a Sally port, the drop off or something like that?
Yeah, and that remains in the west end of the building, but it's moved to be able to bring the bigger dogs or the more aggressive dogs in without bothering the cats back there, which is an issue that we had for a while. So
I will
yes,
tell you, if any of you go out for a tour and need to take your earplugs. It was certainly a challenge to walk through there and come out with any hearing left, but I don't know how they can do it on an 8-hour basis. It's a challenge.
takes a special person.
It does.
So the 100,000 that we've been prior appropriated, that was for professional services, I assume, for the schematics.
Yes, sir.
And this is request is $1,250,000 over and above the 100,000.
$1.2 million, not to exceed $1.2 million.
And that would include the 100,000. Or is that above and beyond?
That is above that.
So it'd be 1.3.
Yeah, and I would think that, and Wes, I think would agree, that's probably a little bit of a high estimate, but we'd rather give some back than not have enough to make sure we do that properly out there.
I guess my only question would be which fund it comes out of. And I know you can't answer that, Sheena, today.
My instinct is that it's going to be out of the discretionary. I think it's going to be hard to come up with specific findings of fact that will relate it back to the pandemic in a way that we can pay for it out of the regulatory. So that's my preliminary.
Even though the influx of numbers, I'm just.
Yeah, well,
thinking
that's
out
the thing
loud.
though, we sit up here and we say, the county's growing, there's more people. You know what I mean? So
Yeah,
those are competing interests that we gotta make sure that it passes the smell test.
And I think originally when the request was put in, it was at that time put in discretionary to
Okay.
start with. So I don't think we're moving it out of where it was. It's just there is a possibility that we might have been able to use some funds, or we may be able to use some funds, but the pot, it really was always in the discretionary pot.
So I know that- I said, I'm sorry, but I'm having difficulty hearing down here. So I know those guys in the back probably are having trouble hearing what you guys are saying as well.
okay.
Speakers are on, I assume.
Yeah.
Thank you.
Also, can you hear me?
Yes.
Yeah,
Yes,
the
sir.
mysterious voice.
Yeah, that's John T. I too toured this facility and this is a worthwhile project. And I just wanted to mention that just recently Animal Control was involved in a SWAT team operation in Greenwood where they had to remove animals. And I just wanted to bring that to everyone's attention. And also I wanted to compliment Rob on, I think many of you missed it. He said categorize, C-A-T, categorize.
Went over my own head.
I'll back off. But anyway, I'm in favor of this that wholeheartedly.
Well, it's a perfect fit. How's that?
That's good.
Everybody's full this morning.
Yeah, and I can see the energy coming. Any further discussion? Anyone entertaining the motion?
I make a motion to forward or proceed with the ordinance for 1.325. Is that right? What's the number?
1 point, not to exceed
Well,
1.2
1.2. Well, we did the one.
for the construction.
Not to exceed 1.2 for
Yes,
the
sir.
construction of the animal shelter expansion.
Second.
Have a motion and second. Any further discussion? Sorry. Oops. Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? I'm sorry.
I was on the I side.
I knew that. Okay. Jonathan was just a tad late, but we have that. Sorry about that, Jonathan. I'll make sure I pause from now on because I forgot you're on Zoom.
It's a delay.
Yes, it is, sir. We'll allow for it. Motion passes. Second on the agenda.
We're not south.
No. Consideration of funding for trailer for health department for mobile vaccination clinic.
So this is my agenda item. First of all, I have some slides that I'd like to have brought up that will explain in detail what it is I'm proposing. Had a few meetings with health department and the director and the doctor talking about how we could meet the response of future mobile vaccination clinic needs. And Marion County uses a RV that they purchase under ARPA funds. This is an example of their RV. I toured the inside of it, showed the pictures to Betsy. It is putting 5 pounds of potatoes in a 2-pound bag. It just doesn't flow well. It's not well designed, in my opinion. So I went and researched what we might be able to use would be better and came up, next slide, please. Came up with a product that is a mobile clinic that can be used for multiple items. And this shows the flow through of it. Next slide, please. This is a service area in the front where there people could be held, or if they had to be taken off to the side for more personal involvement where a door was at. Next slide. This is towards the rear of it where you have the seating for staff, and on the right hand side is fold down seating for people as they come in for a health screening and or a clinic. This just shows that there's refrigerators to store whatever might be needed to be stored from a clinical standpoint. And next slide. This is the actual unit itself, 24-foot with an entry on the side and a flow through that goes out the back, and it's handicap accessible. Next slide. Oh, I'm sorry, I missed one. Okay, and that's just a schematic that there's more detail on it. You see the railing in the back. That is the entrance for handicap, and individuals can come in at that end and then flow through and go out the door on the side of it. And I believe there was one other slide about that showed the ramp itself with glass doors. Is it on there? Yeah, there you go. So that anybody can come in and walk through that. It's very spacious, very open. The product itself is listed as a starting point at $139,000. It's self-contained, totally self-contained electric generators. Can be pulled up anywhere and left and ran. It is capable of being pulled by health department vehicles that currently exist. The total potential all-in cost with freight and everything else, of course, would have to be bid, but the gentleman suggested put in a budget amount of about 160. I believe this is a qualified regulatory expenditure under the responding to the public health emergency section. And under that subsection, transportation to reach vaccinations or testing sites or other prevention and mitigation services for vulnerable populations, temporary medical facilities and other measures to increase COVID-19 treatment capacity. And then what it does, as many opportunities are with the COVID funds, is that it gives us the opportunity to use it for other things that could be done by the health department. And Betsy's going to give a quick overview of that.
Betsy Swearingen, Director of the Health Department. Yeah, we could use it for what we have hired a school nurse liaison that will be running COVID clinics, and we'll be also running vaccination clinics to catch kids back up. So this could be in the parking lot, run in each school and run them through that. Also could be used for maternal and child health issues, smoking cessation, outreach for wellness checks, blood pressure and stuff, health screening stuff such as that for the public at the fair and at a lot of these, community festivals, I guess that's the way of putting it. And so we could go anywhere that the people need us to go.
It could also potentially be used as an employee health clinic until a health clinic was built in the future.
It has that
Could
possibility
be
as well.
parked right over here in the parking lot certain days of the week and.
Doing blood pressure screenings and.
But the justification comes under quote unquote the COVID. But in this case, instead of people having to come down to what we did at Compass Park or what we're doing in the cramped quarters of the health department building, the ability for it to go to sections of the county where people maybe perhaps have transportation challenges or just for pure convenience and outreach. And that was what we spent quite a bit of time talking about, is the ability to take health to the people instead of bringing the people coming to what we provide as far as health services.
Right, and for long-term sustainment, we can also fall under our community paramedicine program. So our paramedicine specialists could take it out for the services that we've partnered with JMH on.
And then the final point was that there have been some questions about, don't we have other trailers? If Betsy could address that.
We have a mobile command, but the mobile command is solely for response. It's for incident command. It's not a flow through trailer. It has one entrance and you would have to exit out that same entrance, and it's set up office style. It's not clinic style. We have 6 other smaller trailers, 3 of which we lend, one to the sheriff's department, one to animal control, and one to the highway department for their use anytime they want it. Lastly, we have a medical reserve, well, 2 more things. We have a medical reserve corps trailer, but that contains all of our generators and our bigger pieces of equipment. And lastly, we do have a decon trailer, but if we repurpose the decon trailer, then we lose an asset in the county for something that could be used in response to an incident.
Plus, in my inspection of it, doesn't have the capability that this particular unit does. And, we justify the need for it. And then someday when we need it, we're going to say, oh, shucks, we don't have it. So I don't think it's large enough compared to the 24-foot on this one with the complete redesign, and the cost would bring it.
No, and to retrofit it from being a decon trailer to a mobile clinic would be
And
expensive,
handicap accessibility.
based on the age of the trailer as well.
So my request is consideration of this, which is, in the big picture of 20 million, 160,000 earmarked is, a small portion, but I think it's an appropriate portion that we should consider and is directly related to what the intent of ARPA is.
The trailer decon, is that the trailer that has the entrance and exit doors on it right now?
The one that we acquired from Bargersville that had been a district asset up until then, and then it sat in Bargersville's parking lot for years, and now we have that.
And that's not able to be a combined unit?
No, it doesn't have
For any reason?
it doesn't have any clinic capabilities whatsoever. It's solely just to shower people and, get them grossly deconned.
Do we have a place inside to store this trailer?
No.
No.
Well, in the new campus.
I'll lead into that. They probably won't like this, but I mean, with the new campus being built, and the health department being a big part of that and looking at that, currently, I would probably not be in favor of this just because we don't know what this new clinic's going to be. I mean, we've seen designs on it. We can modify those designs a little bit if we need a drive-through clinic on this. That's kind of where I'm going to stand today on this. I mean, that's nothing against, I understand going to the people, but logistically it gets difficult. I mean, is this a triage unit? Can you pull it onto, hate to say the mass casualty area,
Absolutely.
and
Yeah.
utilize it for that? It will have the
It would have those
capabilities for that.
capabilities. And that's the sole thing, is to get out to the people. That's the tough part, is getting them to us and then bringing them with whatever they have to our location to expose others there. If we get out and about in the community, then it lessens the chance of spread too.
Yeah,
And with where this has been done throughout the United States, there, it is, you know, it is sort of a modification of getting out to the people, the outreach portion of public health that is not only done in an office and saying you have to drive. We got to realize how many people are transient dependent that have challenges that, you know, this would certainly be more accessible. I don't know of any downside because it doesn't limit the ability for a person to use a future clinic like what you're talking about. And it doesn't mean they won't have it. And we've talked about staffing, and she has the ability to staff it. You know, and it is another arm of public health that we have the potential to fund, and 160,000 out of 20 million is a, you know, I hate to say it, but it's a drop in the bucket.
And it's always a throughput issue when it comes to, you know, vaccination or pills to the people. You know, we have 160,000 roughly people in Johnson County. That's a throughput of every 12 hours of about close to 1,000 for 2 12-hour shifts in each of our 3 pod locations, which we've never ever been able to stand up more than 1 at a time, or staff that one. So if we had a mobile, it would require less staffing, and it would be easier to take it out to the area of denser population and keep them from, you know, flooding our current pod locations.
Bessie, have you talked to any of your counterparts in the area that utilize this type of trailer in response to the recent pandemic?
Well, a lot of health departments have multiple trailers. They'll have a trailer for their maternal and child health. They'll have one for their lead department. They'll have one for their other outreaches, you know, their social outreaches that they do. So yeah, they utilize them a lot. They have teams that's all they do all day long, is go out to the community and serve the needs that way. I think it would be effective. Due to our space constraints where we are now, and we could be looking at another, you know, 3 to 5 years before the campus is complete. This would serve the population well.
In response to your question, that the one that I show for Marion County is only one. They have multiple.
Right, they have, I think they have 5 or 6
Yeah.
currently right now. And yes, that's Marion County, that's bigger, but there are other smaller health departments that have them.
In addition to their tent setups, like what we had at the fairgrounds, but I personally, and I showed them the pictures that we weren't able to coordinate for Betsy to go when I visited it. But it was, I mean, to be in there, you had to stand sideways and just did not function. And it was $280,000 for an RV as opposed to 139 plus cost for a trailer like this. So, and all my research is that there are, you know, if you go back to COVID and not other potential outreaches, that the challenge that everybody had was getting out to the people. And if you recall, I believe who did the, like at Greenwood and several other places with that?
The state brought strike teams in, and Winrose purchased a trailer solely for COVID response and saw great numbers in vaccinating the southern part of the county.
So it's not as if it's a new thing. It's been done.
No, it's been done for years.
You mentioned it can be pulled by existing fleet.
Yes, we have a truck that can pull it.
Is there any licensing requirement of the driver?
No,
Special?
No.
Okay.
No CDL.
it's just like pulling a haul trailer. Take some training for, you know, just for a person who's never done it perhaps, but I know Brian pulls one.
All the time.
My biggest concern is, I think what we're witnessing is an expansion in public service. Hi, everybody. My biggest concern is I think we're witnessing expansion in public services that's not really warranted. I see the health department as providing vital services and protecting the general public from a variety of things, just like inspecting food facilities, septic systems, and so on and so forth. How we've gotten into providing medical services to the general public is a good question. And I'll just talk about vaccination for a second. I don't know how many drugstores we've got in the county and grocery stores that all have pharmacies, and they're all giving vaccinations. They're making it available. We have a number of private care clinics, the emergency clinics, and one thing or another. We've got a county-owned and supported hospital. And then on top of that, when you talk about county employees, the county spends roughly $5.5, maybe $6 million a year providing healthcare coverage for the employees. So I just don't see where we need to be getting into more of this providing vaccination and things of that nature to the general public. I think that's really expanding the scope of the intent of the health department. I'm just giving you my personal opinions on this, of course. I'm just not sure that what you're proposing is warranted or needed. Now, like any issue, we can always demagogue it a little bit and talk about emergency situations or pandemics or certain crisis occasions. And those do occur, but they're limited. And I think when those things occur, then it's time to address it maybe with some spatial needs. But I go back to my adage that I've used a number of times for the sheriff's department and others. You can never be 100% safe. So we're never going to be a total provider and assure 100% health safety to the general public. So
I think
I think the real question here is, are we expanding government services beyond the scope of the original intent?
I could see, I can see that. However, we are the only VFC provider in the county for underinsured and uninsured children and adults. And therefore, they don't have the privileges that we have as county employees to have a good insurance program to provide, free vaccine through our insurance. These people don't have anything. And so the state provides vaccine for them, and getting that out to them. We're currently very behind on our childhood immunizations due to COVID. Kids went back to school without necessary vaccine that they should have had. And if these, if we can get around to people to make sure that they're getting what they need, then that's the services we're providing. We're not expanding it. We're just getting to them when they can't get to us.
And also, again, to remember that ARPA is a response to potential future quote unquote COVID spikes or anything that might occur. And if without a unit like this, we'd end up back out in the mud holes of the fairgrounds, in tents that were blowing all over the place and Quonset huts that were collapsing. And this provides the opportunity to do this on a hard surface, standalone on its own. But the advantage is we have the opportunity for them to continue program. We're not talking about any new programs.
Right.
We're talking about them doing existing programs they now serve. And there were a few others like the ladies with breastfeeding.
Or breast cancer. Yeah, our breast cancer grant, this could help with that too. We could take mobile clinics out for that, where we're currently going through St. Thomas and going into Shelby County into major hospital to provide those clinics. So that is another facet. Plus they're reducing lead levels in children now. So we will have more response in that. And that's not a new program. That's just the state changing the rule on that and reducing that. So there's a lot of opportunities where the hospital, we used to have not the foundation, I can't remember what it's, I'm having a blank right now, that used to provide services for maternal and child health and for cessation and other drugs prevention in kids. This would help with that as well too.
there's no doubt that it would give us the ability to expand services in a variety of areas. I agree to that. But I go back to my original question, are we exceeding the intent of what the health department was originally formed for? And you could take that to any extreme. I mean, you could free medicine for everybody, regardless of their needs.
Yeah, I don't think that, I don't think that's the
Just
intention.
sort of surgical. So that's my question. Are we expanding and exceeding the real need or the intent of the health department in this regard, given what's available to the general public in a variety of areas already in place?
So they're not expanding programs, Ron. They're just delivering them in a different way. These are all existing funded programs that she's talking about, so that the discussion about whether we're expanding the programs, there's no proposal. I'm saying here about expanding programs. I said about proposal for them to have a facility where they can continue to do the programs they're doing in a different way. You know, the disagreement or the concern about whether they should be doing them or not is a different form. They are doing them. It's just they're doing them in their office. And then what the COVID brought about to us, and I'll remind you, even though Johnson County, you know, is a partner in many things, they basically kicked us out and told us we had to find another place because of what was going on during that period of time. We found another place and they kicked us out and said, we got to find another place. They ended up over in the health department office, which is in the current cramped environment. This will take some time to get this unit, but even if we build a facility like what Kevin, we've all been talking about in the campus, it doesn't negate, in my opinion, or in the opinion of the health officer and of Betsy, of the philosophy of delivering our services in a different format. And here's an opportunity for us to fund that at a very low level. And since I've not heard yet $20 million worth of suggestions of how we might allocate some of this money, I think it's a place to start. And if we were comparing it to 20 other $1 million of suggested projects, perhaps it would fall out and wouldn't be a priority. But I've not heard any of those. I don't see any of them on the agenda. So, you know, I mean, you know, we certainly are here to ask, you know, answer any questions, but it's not doing anything new. It's just saying, and I understand, Ron, your expressions about, you know, the issue of COVID, but these funds are there for us to be able to do it differently. And if tomorrow there was an outbreak and we had to do it and we had this unit, we could, you know, as opposed to having to go out and find somebody who'd let us come in and meet all the, you know, all the qualifications of what we have to do and where we have to go. And then, you know, we still would have to have a location to physically put it. But I think there were many opportunities of partners who would share, you know, using a part of their parking lots or wherever we might, you know, be able to take it.
So addressing what you just mentioned, that we're not expanding services, we're just providing it in another mode. Then the question would be, the services we're providing today, are they not adequate?
People just aren't, they're just not so inclined to come out and about. If you can come to them, they're much more accepting of.
So we're really talking convenience here more so than need or adequacy.
Convenience, and it is a need to them, because I think sometimes we have this idea that everybody has a car, everybody has insurance, everybody has gas. They don't. And if we can get to them and get them what they and their children need, I think that's providing the service of public health to the community.
And it is being done in other counties. Morgan County, Shelby County, I forget what other counties actually have units that are similar to what the health department is using in RV capacity. And then if you want to start comparing throughout the United States, there are numerous. I didn't bring all of the backup, you know, but it isn't something new. It's, you know, it would be us coming up to speed with how others do it as it relates to COVID, because that has to be the primary.
Thank you, Betsy.
Any further discussion? I'd entertain a motion.
A motion to approve the appropriation of up to not to exceed $160,000 for the all-in cost of the trailer that was discussed today for the use as discussed.
Second.
I have a motion and a second. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed?
Aye.
Aye.
Yes.
It fails. Yes, you said aye.
Yeah, it's 3-3, right? And it fails.
That would be
3-3.
3-3, yeah. John Myers, 4. Ron Deere, 4. Ron Henderson, 4. West was and Baird, nay. So. Okay, consideration of funding for crisis intervention team.
I also asked for this be put on the agenda. Under consider funding crisis intervention team, this is a qualified regulatory expenditure under behavioral health care and preventing and responding to violence section reference overview of the final rule, page 15, if anybody brought that with them. In reading the documents that were presented to us at the last time and having subsequent discussions with the staff, CIT mission is to promote the intersection of public safety, mental health, and personal and community wellness by providing real-time follow-up assistance to individuals in crisis by facilitating assessments, triage, and linkage to appropriate services. I'd like to comment and add that it also is in result is to reduce the number of times law enforcement staff handle those situations. Mental health refers to one's emotional, psychological, and social well-being. According to the National Alliance of Mental Illness, a mental health crisis or condition is one that affects the person's thinking. The crisis can be the result of a number of underlying issues, including but not limited to prior diagnosis, food insecurity, housing challenges, drug abuse, family violence, and many other influences. The Johnson County CIT Alternatives to Incarceration team, that's a name that I've given just for purposes of presentation, will assess and then connect all adult and juvenile citizens to resources that may be needed for them to be successful in remaining out of the criminal justice system, which is the essence of what CIT is all about. It is not new. It is new to us, but it's not new throughout the United States. It has been funded and is being funded by ARPA funds and many different examples that I found in my research. Under page 15, community violence intervention programs, including evidence-based practices like focused deterrence, which is what this is, with wraparound services such as behavioral therapy, creating beds, what we're talking about doing, trauma recovery, job training, education, housing and relocation services, and financial assistance. CVI, community violence intervention programs, including staffing, support items, and technology, are all unauthorized expenditure according to page 15. And I'm reading from the interpretation of the final rule. I've asked Andy to clarify what was presented to us, but let's make this point, that funding for CIT is a multi-level challenge. One that looks at our county budget as a potential funding source, grants as a potential funding source, and ARPA is a piece of the overall approach that we certainly should consider. Andy, can you come forward?
Andy Barnhart, Chief Deputy of the Sheriff's Office. Councilman Deere called me yesterday and asked if I could clarify a few things that I brought up at the last meeting, because I think I probably did a poor job of explaining some of what we presented. And I think that that was sort of a, like we talked about, a chicken and the egg scenario where we're not sure what to ask for if we don't know what the parameters are. We don't know what the parameters are until we give you what it is we're asking for and things like that. So, excuse me, I think the general gist of it is that the ARPA funding is only going to be one portion of what it is we're looking for in an overall program. And I think that's why it's important to bring that up in these meetings. So the CIT program is one facet, and this black folder that was given to you all, if there was a way to take that back, that it was given at the last meeting, I would love to. This folder was actually designed as a presentation that our CIT team put together to present to the sheriff, to the judges and things like that, as a program that we were conceptualizing to put together to address some of the mental health issues. Its purpose really was not to bring before this committee to determine would the ARPA funding apply specifically to this. So it's great information and it's a wonderful start, but it was really just sort of a brain challenge or something that was done to try to get some rough estimates on some ideas. And that's all it was. So that was given to you to kind of do that, but I think it muddied the waters a little bit on what exactly we're asking for. I think the point is everyone's aware now of what we would like some of the mental health things to go, and the JRAC committee is working on all of those aspects as a large entity, we'll call it. The CIT team is one portion of that, and some of the things very much apply to the ARPA funding, what we would be utilizing it for. And I think that's the point that was trying to be made, is that some of those ARPA funds are available to pay for facets of this. Is it these things specifically in here? No, not necessarily. I think that it would have to be delineated exactly what it is that funding could go for in the overall big picture. But that's something outside of the scope of this thing. So there's going to have to be future funding through the council, whether jail lit is part of that because of the community corrections and recidivism issues that creep up and things like that will have to be determined at later times. But I think the ARPA funding can certainly apply to some of these things to get things going. It's not the whole, it's the sum total of the entire project by any means. I hope that maybe that clarified a little bit, or we can answer any questions that anybody has about.
Big question I've got is, how much are you looking for?
Well, and that's what I was referring to, that
How much you give me? Is that what it is?
I mean, the original numbers I heard, Andy, were like 300,000. That would cover maybe a two-year stint to seed money, basically, from this committee, from ARPA funding, to kickstart this thing and give it a 2-year salary basis. And then from then on, I think there'd been discussion with the council to either pick this up, or they're going to have to pick it up and continue it on. But this is just kind of a stopgap, is the way I saw it.
yes.
But I mean, do you have those numbers? What staff on the CIT team would be for a 2-year period?
And I think some of that roughly is in here. I think that we could definitely put pen to paper and get exact numbers. That would not be a problem. So I think that we'll take whatever we can get from the ARPA funding. I think that's kind of the idea. And I know that's very non-specific. And I know there's certain things that have to be, only certain things can be paid for by the ARPA money. So if you said that, let's just look at the salary, then we could give you the exact numbers on that. Again, it's hard to know what to ask for when we have this large project that's all encompassing a whole lot of things.
I think I can probably address that this budget is not, it was just a seed. I'm not a seed budget. It was to begin discussions, but it isn't for the entire staff as it exists now. It doesn't include, it does include a social worker as the primary funding of a personnel. It does include technology issues, which are ARPA eligible. And I would suggest that in research that I've done in the last week, this is being done throughout the United States. There are examples of being funded at levels that are unbelievable. In LA County, 14.6 million for CIT, and funding everything. I mean, pens and pencils, cars, technology, the entire thing. And so my discussion with Andy is that the ask, I think, as a minimum, is that as it exists now, with expansion of the social worker as the only add-on that doesn't currently exist on your current staff. Am I correct on that?
Yeah, what we have now is we have 4 people that are the CIT team, which is just the one facet of this whole project. And right now they are making do, as we'll call it, part-time or part of their existing duties in the individual departments that they work for. So funding that separately would then enable us to allow them to do that full-time, which they have showed us by numbers that is more than enough business to do that. And then replace their spots in the normal departments with others that can do their jobs that they're kind of, so totally independent of ARPA. Before we even knew that was a thing, this was all stood up as an exercise to figure out what would be a good starting point. And that's why this was put together. And it wasn't until later that we found out that maybe ARPA would be one source of some of that funding.
And it wasn't staff funding, wasn't included in that presentation. That was simply for the one social worker. It didn't include the staff that exists.
Yeah, and I don't think that, after speaking with them on the side, I don't know that if we had to pick, if you said you have X number of dollars, I don't know that the social worker aspect or what would be decided would be the top priority, since this is and that's where I'm saying this is sort of the chicken and the egg thing. I don't know. We don't know what to ask for if we don't know what our parameters are. And I know that's hard to pick the parameters if you don't know what it is. But that's where, the ARPA, or I'm sorry, the JRAC committee has done a lot of work trying to determine the needs of the county and has set up some rough ideas of what those things are that the county might need going forward. So that committee would be the one that I would say would have the large picture. And there are some representatives here that might be able to speak to some of that, including Commissioner Walls, as to what some of the bigger picture stuff is. And then where this ARPA funding, what portion that pays for, it would make sense to make it the stuff that we're already doing. So this is something that, and why we're being seen as the forerunners in the state of Indiana is the people involved took it upon themselves to make this happen despite not having it formally established. And that's why it's a groundbreaking program in the state, is because we made it happen with what we had, and it needs to be picked up long-term from there. And I think everybody agrees with that. It seems as though that everyone agrees that the mental health issue is something that's going to have to be addressed. So that's all we're asking, is this Head Start, whatever it may be. And
it's not unlike what Rob has said about when we're looking at the campus, that it's an opportunity to do creative financing. That parts of the structures at the campus will come from discretionary, potentially part from regulatory, part from the general budget, part from jail lit. I mean, it's a combination, and that's what I perceive was happening here. And let's face it, we can all throw out a number, but we're just throwing out a number that I think there is work that needs to be done. And we had that discussion because there are so many different players involved that any number that is contributed from ARPA funds is certainly a blessing to the program, but it doesn't necessarily mean that the program can be totally funded or should be funded under ARPA funds. But all of us have worked enough budgets to know that one person at the staffing level that they would put people on this, Rob, you can probably give me the better, one person with benefits and everything else at a typical salary for a sheriff probably would be 100,000 total.
Well,
I'm just guessing.
You know what? Maybe this would be helpful. Maybe if this body said, we agree that this is a worthy program, and maybe we want just the CIT crisis response team portion of it, we would be interested in funding that portion, be it salaried, operating expenses. Then and you said that would be, but we don't know what that dollar amount is right now exactly, because it depends on a lot of things. We could go back and get the exact numbers based on the salaries, based on those things, come back and present an exact number if you said that would be what you'd be interested in. But if you tell me, no, we want you to do that plus 3 vehicles plus a mobile, you see what I'm saying? That there's just too many things that we don't know to be able to. So if
may I say something?
Sure.
May I say something, please?
Go ahead, sir.
All right. I'm a bit confused. We started this discussion a couple of meetings back. And I think we're getting tunnel vision on this a bit. There's a great need for this CIT, whatever you call it. The opioid crisis in this county is becoming an exponential problem. This is not only just a crisis response team or a crisis intervention team. It has to be like a tenfold pieces of puzzle, of which this is one. The initial assessment in a crisis is so important. And the money that had been suggested before was for the use of the IRIS software for working with JM Hospital and doing some other things. Of course, we're not specific at this point in time. It's hard to be specific of something that is improving so greatly. And again, once again, we're backing into a problem where we're forced by time and money that it's we need to make these decisions. And here's the reason why I think this decision needs to be made now, is because the problem is now and it is getting greater. I would like to see us move forward with the prior amounts. Thank you.
Which is what, John?
Which, yeah, I've asked this twice. So how much is this? The number that sticks with me is 300,000.
Yeah, wasn't that a prior motion in a prior meeting? Was it not 300?
Well, that was mental health. It didn't say CIT.
I believe it was for CIT.
It says CIT
The
in
minutes.
minutes. Yeah, it was a CIT recommendation. And then I think we were going to come back with some solid numbers for the CIT.
I don't remember that conversation occurring in an ARPA committee meeting. It may have been in a council meeting.
This is a council meeting.
Rob?
No, it was ARPA.
It was
Yeah, it was our
February 16th.
Okay, well, if that came up, I don't remember it being part of the motion. So none of that is
I
really
think we just
relevant.
talked-
I mean, if
I don't
you're
think it
willing to
was
spend
a-
money on it, tell them how much you want to spend.
I don't think it was a motion. I think it was just a number that was thrown out that we were discussing. That it would be a 2-year seed money, basically, to get this operation running now and fund it now.
And I think if $300,000 is the number, because that's what was brought up before, if you say this is the number, we can come back and say, here's what we'll spend it on exactly, and make sure it fits all of the, if you say it's 500,000, we'll come back with a number that, for the.
I'd like to do a little bit something different on this, is if we set a number, have you back into it with salaries. And I know the attorneys probably aren't gonna like that, but we're gonna set a ceiling on this. And you work in underneath of it, and it will substantiate or ratify what that number is when you come in with it. That way it gives you the green light from this committee on funding, but with not knowing the exact amount. Does that make sense?
So you want us to work on salaries, specifically salary?
What I would
That's
like
the
this
discussion.
committee would do would set a number.
Okay.
Okay, and you're gonna back into that number with salaries and what you can get for that amount. And then we have to quantify it through legal and make sure it all fits.
That will help.
This glove fits.
Okay.
And I think it ought to involve some other people like the health department and Johnson County and some other departments that are going to be affected, like Lori Myers's and some other departments. So I think it's important to understand that this is affecting us along a range of departments and areas within the county.
Councilman Myers, is that for the long term, the whole large puzzle piece of which this is only a portion? Or are you talking about for even this initial amount?
Well, Andy, it seems to me that
is not.
there's an attempt here to limit to a certain number. Do you have that number you'd like to limit it to?
I would suggest this, and it's similar to what Kevin's saying, that you have a staff. Come back to us what those numbers are for that staff. And then we can say, no, that we can't. Again, we got $20 million we haven't allocated. And we haven't specified and we haven't earmarked. So, why limit it at 300,000? I'm not saying an empty bucket. I'm saying you have proven the need. Now you're suggesting the staff that you feel is appropriate. And before we start limiting the staff, what you would add in your discussions, mine and the comments that we've had, was that the social worker may not be the top priority, but it was part of your team. So it was 4 current people plus a social worker, which makes 5 people. And then the accompanying services to go along with that technologically and equipment and everything else. And if you present that as what your program is, then how we can fund it at what level of ARPA. And that may be 500,000 a year and maybe 500,000 for 2 years, but none of us know what that is.
May
Instead
I-
of us saying it's 500,000 or 300,000.
May I, Mr. President?
Yes, sir.
Maybe we can do it simply here. Rather than call this crisis intervention team, maybe we call this mental health assessment and care. Something different than pigeonholing this money.
Understood, sir. I'm just trying to take all this in as we beat this horse to death. We have a critical incident management team, correct?
Correct, established by members of other departments that have, I hate to use the term, but they have been designated this as a portion of their job because it affects all of us.
Okay, and then that is basically the team that's making the decisions on how you move forward, how you relate to the public, how you do what you're doing, correct? So it falls under this team.
Yes, as a
So-
portion of, there's the larger committees for JRAC and those, but yes.
So
that is-
basically, you are asking for the funds for that team to continue to do the processes that it does.
That would be wonderful. I don't know if and maybe Councilman Myers is gonna, it sounds like maybe he was wanting to go a different route with it, but if we acknowledge that the CIT team is part of this larger mental health picture and address just that part with the ARPA funds or that and something, I could say it does matter to us, but we're gonna keep proceeding with this program the best that we're able with whatever that may be. And if the body thinks that this is the most important part of it, the CIT team, or at least is the most immediate, and that's not necessarily the most important, but at least the quickest, we've already got it going. So if we can just figure out how to fund it, then that would be to me, that's the easiest thing to keep the foot on the pedal.
My next question would be are we aware of any of the portions of this? Would it be regulatory or discretionary, or are we looking at a split? Are we looking
I
at?
think it's gonna be primarily regulatory, because unless I'm misunderstanding, it seems like you're responding to mental health issues, behavioral health issues, and maybe even some violence.
Yeah, oh, absolutely.
So
Okay.
I think all of those are under the regulatory.
I may be overstepping my bounds here, but I move that
I got some comments before you move.
we can have discussion after I
Okay.
move. But I just want to get the process started. I move that we appropriate or allow funds to be used from the ARPA funds up to $500,000 for the next 24 months to the CIT team so that they can move forward as a kickstart, knowing that you're going to have to come up with other funding through the council or through appropriations. Would that be a fair suggestion?
Sounds wonderful to me.
That's my motion. Second. Have a second. Discussion, sir.
I really don't know where to start here. There's so many things that come into play, but I'll start first with saying that I support the CIT and what you're doing. Early on, Andy, you mentioned that the 4 people on the crisis team right now are part-time. So I assume that when they're not spending their time in regard to the CIT, they're doing some other functions for whatever department that they're employed in. And so if we move these people to full-time, is that going to create a gap that needs to be filled in the departments? And I'm just posing all this as for something for you to think about, and then you can come back to, and eventually I'll tie it all together into a funding kind of aspect. So that's a consideration. Early on, when these funds were given to us by the federal government, I thought we had a consensus at that time that we were not going to use these funds for ongoing expenditures that may or may not be available in the future. We were talking about bricks and mortars and things of that nature. It was a one-time funding. The other thing is that I'm kind of results-oriented individual, and I understand that the CIT, the team, has and can have a major impact on the incarceration numbers. And so there's a distinct and savings that could be associated with their efforts. So if we had some sort of results, and I know, when you're dealing with human behavior, it's hard to quantify, that's for sure, what your successes are, but some indication there of how this early crisis intervention is not eliminating, but reducing the amount of people that are incarcerated. And then on the other side, you got the positive aspects of it, the early intervention of how many of these people we've got into treatment that's been successful. Maybe how many suicides we've avoided and things. So there's a lot of things that this team's doing that's going to be difficult to quantify and put into dollars.
But we do have some numbers on those things.
Yeah,
Those have already been,
and
okay.
I'm gonna let you, you can all tie it all in. The other thing is you're currently being funded through these departments. I would much rather see us come up with some program or some funding source through our local dollars that would support what you guys are doing and even give you the ability to enhance, in other words, full-time or whatever your needs might be, and do that through our current appropriation process through the council and that. I don't know that, 300,000, 500,000, we could throw that out there. You'll consume it for sure 2 years. And then at that point, we're going to be faced with the same decision. And even a bigger decision at that point, because if you use the 500,000 to really increase and enhance what the CIT is doing, and then we get 2 years and the money's gone, and all of a sudden now you got to come back and go to the council and ask for the needed funding and things of that nature. I'd be much more inclined to put this before the council and get the funding that way. And I would support you 100%. Come back, and if you want to make these 4 people full-time and that's easy to quantify the dollars amount there, but we'd have ongoing sustaining of that number would take away the question of what we're going to do in 2 years from now. And during that, and if you wanted to give it some early potential as far as existence, then you can begin to bring in those quantifying numbers that how many people we've been able to keep out of jail, how many people we've been successful in getting back into a productive lifestyle and all of that. Listen, I'm a firm believer in what you guys are doing, and I witnessed on occasion where police officers, sheriff's deputies have been confronted with mental health, and an individual with mental health and had no other resource but to take him to the jail. So yeah, I support you 100%, but I don't think that using the ARPA funds is really going to be a solution to what we need here if we're ongoing.
I agree with you, and I'd like to address that part first, and then I'll jump back to the others. This isn't an intent to permanently fund anything, in my opinion. And that would, of course, be up to the council. But we have received individual support from the council as a body, from the commissioners as a body. And I believe all government officials at the county level agree that something has to be done and that it's going to have to be funded and all those sort of things. So the intent is, whether we get this money or not, is to proceed forward with that exact plan, which is to put something in place, whether it's, how that would look under whose budget or whatever, those details can be ironed out, and that's going to happen regardless. And somebody used the term seed money. I think it was Commissioner Baird. That's That's sort of exactly what we're looking for. This doesn't negate the need to do that long-term funding. And I would like to see it if we're given the go-ahead to proceed with it at this upcoming budget process for 2023. So there's no, well, we're just going to wait 2 years and see what happens and then bring numbers and try to figure it out. We'll proceed with that regardless of whether we get this ARPA funding or not. You could tell us, we're not giving you a dime and we're still going to keep doing it. We have to do this. We have no choice, which is why we're taking sheriff's department and probation employees to dedicate some of their time to this, because it's happening anyway. And we just need specialists to be able to handle it. So we're making do with trying to fund. And that brings me back to your first point, which is exactly right. And I shouldn't have used the term part-time, but what I really meant was they're dedicating their full-time hours. A large portion of that is being taken up by this CIT type work. And that is by choice and by that is an exact extension of their job duties in the sense that it is negating the tail end of it. So if we have road deputies that respond 20 times, and that's not an exaggeration, to a certain house,
Right.
and they can only spend an hour there, there's no criminal, there's other calls stacking up, there's no criminal act, they're not endangering themselves or others, so they can't do an immediate detention. We're going to turn around, we're going to leave, and we're going to turn around and be back sometimes multiple times the same night, if not later. But if we can have our team dedicate 3, 4, 5, 10, whatever hours it takes, where they're not the ones that have to go take other calls and stuff, that's an exact quantification of money and time being saved, because we're not sending the same deputies back to the same house over and over again and wondering, is it going to escalate and turn into a violent situation, which they often do. And we could give concrete real world examples of that. And the juveniles are a big portion of that, which Laura Meyer spoke to. So that brings us back around to that main point that, the people to do it this is something we're doing anyway. And all we've done is say, well, these are the 4 people that are specifically going to handle it. And it's just the numbers are they can't do that as a part of their full-time jobs anymore. There's just too many. That's the numbers you're talking about. They would be able to do this full-time, 4 people for sure. And it's probably something that, down the road is probably going to have to be even more than that. So,
and Ron, there are other funding sources, and I understand that we have a grant writer, and I'm not a grant writer, but from 4 o'clock this morning, I found 2 potential grants that could help fund. They're specific to CIT. One of them is called COPS.us.gov, which has a deadline of June 23rd. Another one was Bureau of Justice doing state grants. And, if this is a priority and we shift our grant writer to assisting finding grants, what this does, it gives us the opportunity to get out in front and have the opportunity for 2 years, 24 months to find alternative sources of funding that don't necessarily mean that we're coming back to the council and the general fund to fund it. I said it could be general fund, it could be grants, it could be ARPA, and we had to be creative in our financing. But and what Brian has suggested and what I've seconded is that we are getting them going so that the sheriff and all the departments aren't dispersing their money and causing their staff to be thinned out by them doing this.
But you're not giving them the funding to go ahead. They're doing it now. My question is, and you twice now you've said that they're spending part of their time, but you'd like to see them spend full time. So each department that one of the crisis team members is a part of, are they not able to spend full time now? Or what's the restriction to keep them from spending?
because they still have
full-time?
caseloads, they still have their other primary job that they need to. So that's where
So that goes back to my earlier question. If they
Yes.
do go full time, is there going to be an absence of employment there that needs to be?
Yes, that's
filled
the
on
whole
that?
point. I believe that Angela Morris would be has said that if Shannon was able to do this as her primary responsibility, she would then fill that spot with another probation officer.
So you would have
And
to,
that was what, so that's already, okay. So I'm-
you would have to hire
counsel.
another person.
Sure, and right now we have Jim Engmark I can speak for the sheriff's office specifically, that he is our community liaison. He works with the schools, he works with the businesses. He also is sort of a backup when we're shorthanded on one of the shifts, and he's doing some of that because he has law enforcement experience and had gone to the academy before. So right now he's a Swiss Army knife that we're using, and the ability to commit him to that, what he's so specifically good at and has shown a forte for is, so we are sort of following the person with that. Then we can put someone else doing his duties by freeing up his line item or freeing up his salary. We would yes, be able to, that's exactly right.
So the simple question is, if you've got 500,000 available for the next 2 years, what would you use it for?
I think that the idea would be that we use it for salaries and then that could, because that,
So
right now, we are existing without anything other than
Yeah.
human beings.
So it's basically, you're just going to supplement the current salary need with the ARPA funds. So there's
And
not going to be
operating.
any enhancement of the service or any of that nature. And that still doesn't address, if they go to full-time, the employees are going to have to be hired to supplement.
But
them.
that money already exists. That money already exists. If this money can be dedicated to their salaries, if that's what I'm
Yeah.
hearing is then that's the new funding source for their salaries, which then frees up their existing line items in the current budget.
Yeah,
So
but
we
that's
can
just
fill
2
some-
years.
Correct, but that's where I've said that we were going to, the intent was to come before the council and ask for that to happen permanently anyway. I guess maybe what we're asking for is a boost, the seed money to get started.
You're already started.
We are starting with the resources that we have by straining the resources of these departments. Yes, that's correct. So we are, and I hate to use robbing Peter to pay Paul in the sense that we are forcing it to happen because there's the needs there, using existing resources. That is not sustainable for permanently, correct?
So
That's
I go
something the
back to
council will have to
what I
address.
originally said, and again, I support you 100%. There's absolutely no question there. What we need to do, I feel like, is get this into the budget process
Yes.
as soon as we can.
Absolutely.
Even go before the council now with an additional appropriation. to carry
We
it
could,
through
but
the
we've been
remaining-
asked to hold off and not do that mid-year ideally.
Well, but there's a need here, and I think that would supplement the.
Sure, and that's up to this committee. If you don't want,
At least resolve any time issue.
so I can tell you, we'll do it, no, we'll do it anyway. We'll do it any way we
Yeah.
can.
Hi, Angela Morris, Director of Court Services. At the council meeting last month, I had asked for a new juvenile officer to replace Shannon Chambers. So we already did that
Good.
on the juvenile side. I think the intention for this money would be to hire additional people to the 4 that we already have. In that, so there could be a night shift, maybe, team, vehicles, office equipment, office furniture, things like that, to actually have devoted employees just to CIT.
And how many additional employees would you suggest?
4.
Well, I would probably leave that up to the sheriff's department to determine what the needs are for each shift. This started as a training. We just trained other officers in CIT and it's grown so much, and we've been privileged to speak in front of like the Judicial College, and NAMI has recognized us now as a regional site. And part of the training involves the team that goes out. It's called Joe and Ernie, if you ever want to watch it. That's obviously what we're trying to model after, but we need probably people on every shift. And so whether that's 2, 4, 6, 8, 8 at a minimum, a clerical person, and then the staff therapist to be on. So
You're up to 10 people?
yeah, and then with the multiple departments working together, like Shannon is still the training coordinator for court services. And so
Yeah.
her time would be shared, and Jimmy's would be shared on things he needs to do with the school or the mental health liaison. Chad Pointer's my field officer supervisor right now. He works with the problem solving courts. Damon Cox is already the assistant director at juvenile community corrections. So I don't see them leaving this, what we're doing, but they would be, that we just need some more people to be able to respond to those needs, and then the other duties not fall off.
Yeah.
I don't know if that helped any or.
Just understand what you're saying.
So I guess it's a matter of fund it now through ARPA or fund it through the council, through the general fund. So to me, through ARPA would save the general fund some money for 2 years.
So guys in a contest, what's going on here?
Just listening.
Yes, sir.
Thank you.
Any additional?
At this point, I think prior to further, I would like to amend my motion. And I would like for Mr. Henderson to explain that. I really like his position on this.
Thank you. So I love what is happening, and the dialogue obviously is always good in public settings. I would like to see this to be further enhancement to the team, meaning you're building around something today and use this ARPA money that is what we believe initially will be a regulatory bucket, right? And we have through December 31st of 2024 to obligate ARPA funds that then must be fully expended by the end of calendar year 2026. And I would also like to, if I recall Lori Meyer's kind of not acknowledgement, but her kind of plea to consider the youth in this crisis intervention team or process. So my thing is, I'm supportive of all of that. I was concerned with the 24-month time frame and the dollar amount. I would like to see this spread out until it's more formalized. And it sounds like it's an evolving process, but to limit it to $100,000 per fiscal year. And so, but not the 24 months. So I mean, throughout the remaining term of the ARPA funds, up to $100,000 per fiscal year, and have some feedback or direction in how we're going to incorporate a youth aspect into the crisis intervention team that would address a more comprehensive part of a larger part of our community.
Yeah,
That's
Mr. President.
John,
Yes, sir.
Look,
Um,
have you done yet?
Were you done? Were you
Yeah,
finished? Rob?
yeah,
Okay,
I'm fine.
go ahead, sir.
I think, Rob, your comments are appreciated, but I don't think it's enough. The reason being, and I think we had these initial discussions with the ARPA funds, it gives us a more immediate attack of this problem, which is, it is a more immediate need. The other thing that it does not allow us to do is go to this 24-hour capability, because these types of incidents and these incidents of crisis don't happen from 8 to 5. And so it's really, I believe it's taxing our sheriff's department, and I believe in what they're doing wholeheartedly. I mean, my goodness, sheriff is to be commended for starting this, but I just don't think it's enough money to support the 24-hour capability, which is greatly needed, because these people who are in crisis come at all hours of the day.
Well, I feel I would disagree that an additional $100,000 is not enough to get things going if the program's already partially funded or I guess fully funded to Ron's comments, and it's gotten this far. I think the additional 100,000 can train more. If I'm reading the black binder that was passed out, these folks are going to get 4 trainings a year. Each graduating individual receives a pin. So the program is designed, I believe, to continue. It's a continuing ed in a way, and it's to educate and train new people. As someone graduates the program, you're backfilling it. That's well, otherwise you're not graduating.
Okay, well, and what I'm thinking that we're having a difference of discussion on is that I believe that this response team or intervention team not only trains, and I believe that training is the first point of the spear, is that's what we need to do. But this is a response team to handle a crisis out in the community and get an initial assessment of an individual so that they can get the proper treatment.
May I step in again for something to clarify that a little bit? Maybe that's part of, and this is where we have so many different committees and different things, and now we're talking specifically to this committee about this money. And that, whereas this is something that's been discussed for years now, and it's very large. The CIT team is twofold right now. It is a crisis response team where we do respond, and that's where if we could do it 24 hours a day, that would be great, because then we don't have to have the like was stated, it's not a Monday through Friday 8 to 4:30 type thing. All right. The second aspect of that is the training, which is training law enforcement officers and first responders in how to deal with that until something else can happen. So the training is not to train people to be part of this immediate team. We have the team that handles that, that responds to the crises. In the meantime, while this is in an ideal world, while the officers are there on the scene, because they've been trained in identifying these problems and identifying that, okay, we're here because of an out of control juvenile. And let me say real quick too, that yes, the juveniles, a large majority of what we're responding to is juvenile. So I'm not delineating adult, child, anything here. This is juveniles, adults, all. In fact, I would say, I don't know what the number is, but probably half of the people that we currently are responding to are juveniles. So this is not something that we need to make sure we add them into. This is what we're already
And the
doing.
training component is to train all officers.
Ideally, all officers.
to
Greenwood City is
identify.
committed to, the sheriff is committed to all deputies, all Greenwood police officers. And we're trying to get all of the law enforcement officers in the county to be trained in identifying, dealing with the immediate needs, and then handing that off to the team, who will then take it from there. That's the part, and real quick. I think what we've had is this first responder issue with limited ability to do things with, and then we have, the medical community, which deals with the long-term mental health and substance abuse issues. And what we're missing is that in between. And that's what we're trying to fill with the CIT team and the CIT training, is that in between facet to get them from, okay, well, I don't know what to do with this person, so we're just going to leave, or, well, we're going to take them to jail for criminal mischief, even though that's not going to do anybody any good, but at least it's getting us to where we can go take another call now, getting them to where they need long-term. And that's, if you want to call it program management or navigation or whatever term buzzword you want to throw at it, to get the people from point A to point B, or let's say point A to point C, we need that B is what we need.
I appreciate it.
We beat on the crap. Let me amend my motion. I can do that, correct? As I know we're just, I think we all, and I honestly believe we all have the same passion in responsibility to what you're doing and accountability to that. I think what we're trying to do is make this reasonable, that there's some accountability as we move forward. So what I would like to motion is that we initially invest $200,000 to the CIT team, followed by 2 years of $150,000 with justification to that from ARPA funds. So we're basically talking 3 years. In 3 years, we're getting back up to what I originally motioned in 2.
Which is the 500,000.
Which is the 500,000. Yes, that would be my motion.
And I think it gives council good opportunity to start building it into the general fund, and how they're going to fund it gives you some leeway to build that in for permanent funding.
I'd agree.
With the suggestions again of Mr. Henderson of the involving the youth, which I think we do a good job of so far. We just need to expand on that.
And explore grants. I mean, this is the open end. There may be, they're just the 2 grants that I found, and I'm not a grant writer. And then the judges are supportive of it, and they may have some federal dollars. It is giving the glow light that we are committed as a community, as a council and as commissioners, to get it going and putting our support behind it. So I second it. Do we have to withdraw the other motion?
No, I was just going to say that. He amended it. You were the second. Do you agree with the amendment?
Yeah.
Okay, perfect.
So
would there be consideration in that motion that this money would be utilized for that purpose up until such time as the council moves on permanent funding? In other words, if through the budget process this year and the start of next year, the funding comes through our normal processes, that would then eliminate the use of this going forward.
I'm not suggesting in the motion that it be eliminated. I think it's supplemental too.
Well, the reason I propose that is because I don't want to wait 4 years for the council to take action, and having these funds available for 4 years might do exactly that.
But Ron, we're going to have to take action because I think from what I've heard from Andy and the others, that will not cover the 4 persons as it currently exists, let alone 24-hour coverage. So we are going to have to address it anyway.
So if you address it and we provide funding so that their program is sustained ongoing, then there would be no need to use the whatever funds have not been expended.
I disagree with that.
Well, but I think that's really been covered in the motion anyway because of the justification. So if there's funding available for that, the justification would be is they no longer need that. But that would be them.
Or they do need it.
Justifying, or they do.
Or it's
need it.
part of the bigger picture.
Right, it's with justification. So I think that's something that gives us some leeway in
Here's how we can
that.
paper it. So just so the CIT is aware, the commissioners, if this passes, will be presented with an ordinance and we'll have to have some more details as far as your breakdown of your expenditures so that we can do the ordinance. So we could do the ordinance for that initial outlay that you proposed of the 200,000, and then we could do additional ordinances for the 150 as those come, and that would be the mechanism by which you justify whether it's needed or not.
Because we do have the 2 years up to 24 months.
Right.
Agreeable on the second?
Yeah.
I have a question just for the minutes.
Uh-huh.
At one point, it was mentioned not to exceed $500,000. So is that something that?
That
No,
motion was amended at
He
that time.
amended the motion to be an initial investment of 200,000 followed by 2 years of $150,000 each, as long as it can be justified.
Okay, thank you.
Okay, so we have a motion and a second with those parameters. I'm writing on this. All those in favor signify by saying aye.
Aye.
Opposed.
Well, I didn't oppose that. I support it. I don't particularly like the method by which we're doing it, but I'm still going to be in support of getting in whatever we can to help.
All right, and then the final item is that you all received a report that I requested from the Chena compiled and did an excellent job on our allocations and the processes of where the monies are at. And what it shows is that we still have decisions to make of how approximately $19 million of regulatory funds could be spent. And I brought forward a few recommendations, and I'm assuming that the invitation is still there for others on this committee to put
Yes.
forward recommendations of how to spend what we've not already sent into the pipeline.
That is correct.
My
Correct
understanding
assumption.
is that there's a standing instruction that if anyone wants to add something to the agenda, they email it to me before the next ARPA committee meeting, and then Commissioner Baird and I talk about what will be added for time constraints and, what makes sense. Okay?
Yeah.
Fair?
Hopefully we'll get more than a week's notice. I appreciate we acted quickly, but
Well, we had to act quickly because of the council. Your request to be on the council's agenda are due on Wednesday at noon. So that's why we.
Prior to adjournment, though, can we possibly set, while we're all together, set another meeting for the future?
Yeah.
We can do that. Sorry, ladies and gentlemen, but things are busy, so we got to do it when we can.
Well, we've got two.
You want to
three
keep it
weeks.
on a Tuesday?
As long as, it's understood that my constraints on Tuesday are a little, I have to be gone by 11:45 at the latest on Tuesdays. We can start earlier if that helps, but nothing at this
Nothing yet,
point.
okay.
Are we looking at a couple weeks? Do we, I leave on the first.
14th works.
14th.
Works.
14th is at East Central with that. Right.
Yeah, 14th, East Central District. So
Yeah, I can't do the
Doesn't work,
14th.
man.
I can't do the 14th.
You can or can't?
Can't do the 14th.
what dates can,
23rd.
It's a Tuesday, the only one.
it doesn't have to be a Tuesday, does it, gentlemen? Whatever dates work for,
Just throw a date out there.
June 15th.
Yes.
What time?
I'm out the week of the 13th.
so then,
June 15th.
Out that week.
So throw a date.
yeah, how about the following week, the week of the 20th?
Well, that 15th didn't work.
23rd.
22nd. What do you say, Rob?
I can't. Travel day.
Okay.
When you can that week, Mark, Ron.
23rd,
Can you do 21st?
23rd works for me.
23rd.
Kentucky.
23rd.
I know.
You guys can have it.
23rd works for me.
Are you up on that whole week?
I'm pretty much gone the 13th through the 28th.
Mm.
So I.
Can
Yeah,
I,
that's
can I
what
be
thought.
I'll be a bodyguard for you.
I'll drive.
Yeah, that's fine. Yeah. I'm here on the 23rd. And
You're on the 23rd,
yeah,
Rob?
and I'm here on the 24th, except for 8:30.
Well, 24th is AIC state call meeting.
Yeah, 23rd works for me.
23rd, 23rd,
23rd, both your lawyers are gonna be gone.
both what?
Both your
10
lawyers are
o'clock?
gone on the 23rd.
That's, we'll take it.
We'll take it. We can get a lot done in that meeting.
We have a
The attorney's
conference,
not
we have
present.
a full day conference on the 23rd.
Okay.
And of course, we have to coordinate with Dan Hedden too, so maybe you need to throw
Well,
out a couple of days.
But all you're gonna tell us is it depends.
That's what lawyers do.
23rd,
What time?
you want to do it without or with it?
If Dan can be here, you can do it on the 23rd. How about that?
I think we got to pick a date because we got to meet somehow. And if that date works for everybody, it's on the,
You'll be gone too.
We're both going to the same conference.
You can move it to the 30th of June. That's it. That's really a month, over a month. But you're beating a lot of time.
how about prior to June 1st? Anybody got dates?
Prior to what?
June 1st, which would be the next couple weeks.
Do it on
June
Tuesday.
2nd.
Do it on May 31st.
31st
May 31st.
works.
I'm no good, June 2nd.
How about May 31st?
Yeah,
I'm open.
That's a week away. It gives us time. And I know you didn't want a week's notice, but that's where we're at.
So that'll go to the end of June.
31st works.
and so we can clarify day, the agenda will be to hear additional suggestions that are gonna have to get to her by, if it's only a week away, I'm just trying to,
There will be
Yeah, I
items
need
put
them
on the agenda for the 31st out of suggestions or
Thursday by 10 would be ideal to have those suggestions.
next Thursday.
This Thursday.
this.
This is next month or next Tuesday is the meeting.
And if we don't do that, then we're a month out. So
Tomorrow, you have to get the additional suggestion to you by tomorrow. You've got my additional
I've
suggestion.
got,
Thursday.
I would say I've already got. yours.
You've got
done the
my
work.
additional
Thursday.
suggestion.
Thursday, which is day after tomorrow.
All right, you
May
got-
31st at 10 a.m.
Okay.
May
Okay.
31st, 10 a.m.
Move to adjourn.
Who did your second?
All right, thanks.
Thanks.
Thank you.
Adjourn.
Okay.
We are
Thank you.
adjourned.
We gotta go.